there. Welcome to Dr. Z's Pharmacy. I know it looks like every single one of my offices, but trust me, this is the pharmacy. And yeah. I hope you're doing well. So what brings you to the pharmacy today? You want a little tour of what we have? That's fine by me. We don't have too many patients coming in right now for their prescriptions, so I have enough time. I can do that. So yeah. At Dr. Z's Pharmacy, we take patient comfort to a whole nother level. We make sure that they are relaxed and rejuvenated after each visit. And yes, we do use ASMR to achieve that. So, where do you want to start our little tour? Or tell me like what problems that you have. Okay. So you have seasonal allergies? Oh, me too. Yeah, I actually have all year allergies, so I know the allergy section extra well. Here's the first thing. This is the Zyrtec, pretty common brand. This one has 70 tablets, and each of them have 10 milligrams of cetirizine. And that is an antihistamine. So that's the most common type of allergy medicine. You can get your antihistamines, and that should help with a lot of the symptoms, such as, like it says on here, itchy, watery eyes, sneezing, runny nose, basically all of the stuff that comes with allergies. Next thing that I have is a Flonase. You did tell me that your allergies are mostly like in your nose. It's a lot of nasal congestion, sinus pressure. So Flonase does a really good job of helping You want to make sure that you're shaking this well before each time you put it in your nose.
So this one has a glucocorticoid in it. So this is not like an antihistamine. This is a steroid that will, basically what it does is it alters the gene expression to make the swelling in your nose and other allergy symptoms lessen.
You just clip this button to spray it. Just push it down. Another product that I highly recommend for allergies is this. I can actually show you what it how it sprays, because it's just a saline spray, so it won't, like, it's drug free. So is there anything else you want to look at? Heartburn. So the one brand I always recommend for you said your heartburn isn't like severe, it's just you get it every once in a while. That's annoying. Get some Tums. Tums, tum.
You can smell the cherry flavor from just out the bag. It's so intense. They taste like candies.
These are the Cherry Delights. So they're little small candy cubes. And it helps with heartburn, of course. Sour stomach, so your stomach doesn't feel good, you can take it. Indigestion, any kind of like stuff that's wrong with your stomach. See, they're quite sizable, but they taste really good, so yeah, highly recommend it. Now we also have the original Tums. This one's an assorted fruit, but original Tums are actually a little like, they're kind of like candies too, but they're not chewy. They're like, kind of like a sweet tart. lid is pretty easy to open. Now you don't want to take these little tablet things. You don't want to take more than 7 in one day, okay? Usually you start with 2, and if 2 doesn't work, then you can go to 3. And then about every 8 hours or 6 hours or so, you can take another dose. Okay? Having a painkiller in your pantry is an essential. And you said you were low on yours, so this is my recommendation. It's the Advil liquid gels. So yeah, this is with
ibuprofen.
So Advil is very good for, you don't want to take this every, this is not like a daily thing by any means. It's really for the occasional pain, or like a week long of pain. If you have something like chronic arthritis or something like that, you'd probably want to get something like Aleve, just because that one isn't as harsh on your body as ibuprofen.
They're very small, so you don't have to worry about swallowing big pills. And you really want to be careful about taking the ibuprofen. Any kind of ibuprofen, whether it's Advil, I think Motrin, because it can be harsh on your stomach.
Yeah, so what I do is I normally eat something. It doesn't have to be like a big thing. It can just be like a few bites of something, just so you have something in your stomach while the medicine is doing its thing. And actually, we're very close to our cold aisle. And it's always nice to have your cold aisle stocked up. Your cold medicine, not your aisle. So yeah, I have a few things I can recommend. Yeah. So you can get our brand, our store brand, or you can just get Dayquil. This is basically Dayquil.
And it's in a liquid form. So, if you have a hard time swallowing big pills, this is the way to go.
It comes with a little measuring cup. Yes, it's very orange. It looks almost radioactive, but trust me, it is safe. A lot of people, will use this because, that's just what they grew up with. Liquid stuff. This measuring cup is really useful because it has the measurements for a full dose, which take more than 20. Just want to make sure I'm giving you the right info. Okay, yeah. So you can see there's an instruction here. So this has a pain reliever, cough suppressant, and a nasal decongestant all in here. So you don't have to take another pain reliever. You shouldn't take another pain reliever when you're using this. Another thing I recommend for my patients is to have some sort of rehydration supplement or drink. It can be like Gatorade or any kind of sports drink that has electrolytes in it. Yeah, there's different, you don't have to get Gatorade, there's so many different other kinds of sports drinks out there. So this one is liquid IV, and it really is just literally liquid IV. It's 2 to 2.5 times faster than if you were to drink just normal water. It really is super water. And yeah.
This one is passion fruit flavored. They also have watermelon and lemon lime. Here.
So this is a serving size. And it could fill up quite a few cups of water. Just because of how big it is. So it's a little drink mix in powder form. And you just stir it into water. And it tastes really good. I've had it before, it's good. Another thing I like to recommend to my patients is an immune support, like elderberry. This is the Sambucil elderberry. There's so many different elderberries here we have, but I really like the Sambucil. It's the most well known from my experience. It's a very, very thick, dark liquid, but it doesn't taste bad at all. It's quite sweet and tart.
So it says that it's gluten-free. I don't think you had any gluten allergies, did you? No, okay. Did you take 2 teaspoons?
2 teaspoons. What this does is that it helps prevent you get colds in the first place. And so it's a bit of a supplement. And if you do have a cold, it will shorten the cold. So like it says on the bottom, or on the bottle, it's scientifically tested, supports immunity, and has high antioxidant levels, which, you know, kind of the same thing. If it has high antioxidants, that's going to be good for your immune system. So we have a lot of different supplements here. You did say that you want to get better sleep. L-theanine will do that for you. So this helps with any stress you're having, anxiety. And this is in a powder form, so you could mix it into anything. No flavor at all. This has a lot of servings in it. 500 servings to be exact. So this will last you a very long time. Now, because I'm not your primary doctor, I don't really know all of your medical history. You do want to ask your doctor before trying any kind of supplement. Especially if you're taking medication or have any kind of condition. Please ask your doctor first. But L-theanine is usually used for stress and anxiety. Alright. Thank you so much for visiting the pharmacy today. It was nice to show you around. And yeah, if you never need any more help or any product recommendations, feel free to come back,